during the early stage of the pandemic, the journal Health Sociology Review is calling for a paper for the special issue, and they want to have a special issue on the virus from a sociological perspective, not necessarily a post-colonial perspective. And then I got some observation from Hong Kong as well, which is a little bit different from what happened in the West, in Australia, in the UK and the US. And now here in Australia or in the US, during the early stage of the pandemic, there were a lot of concerns about the rise of racism against Asian people. There were a lot of anxieties about whether Asian people would spread the virus to the wider community and so forth. And when I observed the public reaction to the virus in Hong Kong, I found that the situation there could tell us something a little bit different. And I could see the rise of anti-Chinese sentiment, and also a lot of xenophobic emotions in Hong Kong. And so which is a little bit different, from the media discourse here in Australia, saying, hey, no, we should stop racism, we should be more careful about the way that we use our language. And that's why I think the pandemic is not just a health issue, and it also triggered a lot of traumatic memories in Hong Kong from the SARS epidemic. If you remember the SARS epidemic in 2003, that also involved the problematic relationship between China and Hong Kong. So that's why I wanted to write about the whole issue. And I want to go beyond the anti-racist reason that we often hear, in the media discourse, and explore the pandemic and the virus from a post-colonial perspective. When it comes to post-colonial theory or post-colonial perspective, there are many definitions. And it is not a very, even the field itself, like the post-colonial studies itself, is not a very neat field at all. There are different scholars talking about different things. Some of them talking about decolonization, decoloniality, and so on. But my description or the definition of post-colonial theory is rather simple. If I use the definition given by Robert Young and Stuart Hall, I mainly focus on the after effects of colonialism or imperialism, not just in Hong Kong or Australia, which is a former British colony, but also I want to extend that to China, because China was deeply influenced by the Soviet Union before 1978. And so I think the post-colonial perspective can tell us a lot about the legacies of imperial rule, colonial rule, even upon the health issues right now, and also the public policy of health in the current situation, the post-colonial regimes. So if we don't understand the colonial past, it's very difficult to understand the present situation. So that's why I think the post-colonial perspective is very useful for us to understand more about what is beyond the anti-racist reason. I would like to give two examples in terms of using the post-colonial perspective to understand the pandemic and health politics. The first example is from China. Then which is not research done by me, but I read brilliant work on the Soviet influence on the current health regime in China. And what happened is that before the reform and opening up in China, like they did have a healthcare system which is similar to the Soviet Union, and then there are different healthcare centers, for different diseases, and the author argued that from the SARS epidemic in 2003, that even though China reformed in the way that is following the US model right now after 1978, they still need to grapple with the old system in the past, and which may not be able to enable them to deal with a big global health crisis like COVID-19. And that is one example that I can cite, to illustrate why it is useful to look at the post-colonial perspective. That is, in China, still, even though today they are very strong and they're economically very powerful, they still need to handle a lot of crises which are unprecedented before. And so the second example is about Hong Kong. Now, if we look at the xenophobic attitudes by the healthcare workers in Hong Kong towards the mainland citizens, then what can we tell, from that kind of political conflict? Now, first of all, before COVID-19, there were lots of issues related to the relation between China and Hong Kong, or I would say the weakening boundary of China and Hong Kong under the one country, two systems, which made people feel very uncomfortable and anxious about the future. First of all, we had the birth tourism boom. A lot of mainlanders would like to go to Hong Kong and then give birth to their babies in Hong Kong in public hospitals, and a lot of local people, even the medical workers, said that look, we are in our full capacity, so it is very difficult for us to handle so many patients from the mainland. So that's why during the pandemic, they even threatened to take industrial action. To a lot of people, that was regarded as racist or xenophobic and so on. But if we don't understand what happened before, such as the birth tourism boom, as well as the privatization of public health care, and also the mass infrastructure such as the expressway connecting Hong Kong to China, then it is very, very difficult to understand why in Hong Kong, the healthcare workers don't actually show any sympathy towards the patients, right? Because we expect that all the healthcare workers should be more altruistic, should show their compassion for the sick people. But why in Hong Kong these people are very different? They are so uncomfortable about the mainland patients. And I think the post-colonial perspective can help us understand a lot more about what happened before, and that's why we have the problems right now. So the main point that I want to illustrate in the paper is that the pandemic politics is not just about whether we should wear face masks or not, okay? But it is connected to some deeper issues such as the political order under the one country, two systems principle. Was not in this paper, but in another magazine article that I wrote. It's written in Chinese. I did at the beginning use the word Wuhan virus, but that magazine was in Taiwan, okay? And the editor didn't mind, I used the word Wuhan virus. But immediately after that article was released, was published online, then the editor sent an email to me. They got a complaint from a mainland reader saying that I shouldn't use the word Wuhan virus because that is discriminatory, which in a way is sort of a reminder to me as well about this paper, like this paper published in Health Sociology Review, because I need to be aware about the readers, whether they would misunderstand my message or not, because I did have some very did I promote racism, or did I write this in order to justify racism against Asians? Of course not. I'm not, right? But I keep emphasizing in the paper that the postcolonial perspective is to shift the attention from being in the center, right, to the periphery. That means we shift the attention from the Western media, looking at the situation in the West, to look at the situation in the post-colonial context from local audience perspective. So that is the interesting thing about this paper. And I also want to say a few words, about whether why the post-colonial perspective is helpful to understand not just the pandemic, but also other social issues and educational issues, because we often talk about the situation in our own country, which is understandable, right? But if we are trying to go beyond the local context to understand more about what happened in the other parts of the world or the rest of the world, then we can see that actually the people there are grappling with different issues and challenges. And the post-colonial perspective can help us to shift the attention from the center to the periphery. And I think this is very helpful for us, not just in understanding health, but also in other social domains. First of all, I am not in the health sociology this field, and I can say that the benefit is not just we are all required to publish, and then that is the stressful part. But what I learned from writing about this paper is that sometimes ideas just pop up immediately, and then you can write it up very quickly. So as long as the ideas are something that can connect to what you have read, the theoretical work that you have read, this is what I realized. Right? But sometimes, right now, I am struggling to grope for the words, for another paper, and sometimes it takes time. And for me, to write about this paper is that I realized that it is easier to get published, in a special issue. And the second thing is, I think observation about the reality, the empirical reality, is very important. And some people even say that, to let the situation affect you. That means when I look at the news, when I see a lot of doctors, nurses during the pandemic threaten to strike, what does that mean to sociology of health? Or maybe what is the significance of this issue? Is it just about the problem of xenophobic attitudes towards China, and also things like that? Does it speak more than that? And I think this sort of dialogue between the reality, like the protests that I can see in Hong Kong, or the problems of handling the virus, the lockdown in Wuhan, how does these things in reality connect to the theory that we have read, such as postcolonialism and so forth. And to make a connection is very important and also very beneficial to me about how to do research and how to write a research paper. So I think this is a very helpful exercise for me to understand. So I'm sure that all the other HDR candidates can also use this sort of technique to help their studies.